Welcome back to Mountain Connections. Right now we are turning our attention to your health. There is a big breakthrough recently that helps limit the negative side effects of chemotherapy, specifically with lung cancer patients, that may be able to be applied to other patients dealing with chemotherapy and cancer treatments. I recently spoke with Dr. Vincent Lam all about this. Let's take a look.
Right now, we are focusing on a new treatment that limits chemotherapy side effects. There's game-changing breakthroughs for lung cancer patients that can benefit others. And here to tell us all about this is Dr. Vincent Lam, an assistant professor of oncology at Johns Hopkins. And he's also a clinical translational investigator with a special interest in lung cancer. Dr. Lam, thanks for being here today.
Thank you so much, Christine. Thanks for having me.
We all know so many people who experience the negative side effects of chemotherapy. Some even say the treatment is as bad or worse than the disease. You now have a new treatment for the side effects of some chemotherapy, specifically for small cell lung cancer patients. What impact will this have on a patient's experience?
You're absolutely right. Many people have seen loved ones struggle with the side effects of chemotherapy, or perhaps have even personally experienced it themselves. These side effects often can include hair loss, significant fatigue, and low blood counts, which can be life-threatening. So we're really excited to have a new drug in our toolbox that can help reduce some of these debilitating side effects, thus making chemotherapy potentially safer and more tolerable for our patients.
And how exactly does this new treatment work?
So in general, chemotherapy works by killing the fast-growing cells in our body. These are exactly the cancer cells that we're actually trying to target. Unfortunately, there can be some collateral damage, and that good cells are often impacted, such as white blood cells that help fight infection, or red blood cells that help carry oxygen in our blood. So this new treatment is given before chemotherapy has started, and in a way temporarily puts these good cells to sleep so that they can be protected from the collateral damage.
Are there other treatments that are in research?
Oh, absolutely. Lung cancer research is happening every day. I often tell my patients that we've made more progress in lung cancer in the past 5 to 7 years than the previous 30 years combined. So on the whole, our patients with lung cancer are living longer than we've ever seen, and that's because of research. So for example, one major advance is that we don't use a one-size-fits-all approach anymore in lung cancer. By personalizing the treatment for each patient's specific tumor, we're able to achieve better outcomes. So it's not the case anymore that everybody just gets chemotherapy. Some patients may benefit from a non-chemotherapy pill, or even some of the newer immune-based therapies.
How important is this new treatment for lung cancer patients who are diagnosed with small cell lung cancer? And is there research to see if this treatment could benefit other types of cancers?
Yeah, it's really important for our small cell lung cancer patients specifically, because the chemotherapy is such a critical part of our treatment for that disease. And this new chemoprotection drug is currently only FDA approved for small cell lung cancer. However, there are clinical trials ongoing to investigate this approach in other cancers as well, such as breast cancer, colon cancer, and bladder cancer. So I would encourage patients to discuss this option with their doctors to see if this is something that could be helpful for their particular situation, or if there's a clinical trial that would make sense for them.
And where can we get more information? This is something very important for many to consider.
Yeah, we're partnering up with Lung Cancer Foundation of America, so you can go to their website, and it's such an excellent resource for just education and news like this. So it's LCFA, LCFamerica.org. Pardon me, LCFamerica.org. So check that website out and help join our cause to raise awareness about lung cancer and research.
That's such great information. Thank you so much, Dr. Vincent Lam, for joining us today. Appreciate everything you've told us about chemotherapy and these treatments that may help relieve some of those symptoms. Thanks for your time today.
Thank you so much.